Welcome back to day one. So we're going to be looking at this article on PubMed. It was printed just about a month ago. Not printed like in paper, but printed online, published online. So it looks at 10 patients over 10 years, and it follows them evaluating for whether or not they have cardiovascular risk factors. So these children, it's a study about children. They've been following the ketogenic diet for 10 years. They range from ages 1 month old to 18 years old when they started the study, and they all have the same issue. They have a GLUT1 deficiency. So a GLUT1 deficiency is when someone in their brain doesn't have a GLUT1 receptor to allow glucose to come in, and when they don't have that, the glucose will stagnate in their blood supply, and that can cause swelling and many other issues like encephalopathy. And so they went through a ketogenic diet treatment for 10 years, it's really rare to find a study that has that much history behind it. It's very easy to find studies that are like 6 months. It's a little bit harder to find studies that are a year, 2 years, and it's extremely hard to find studies that are 3 to 5 years, but 10 years is even more amazing. And so then they say what kind of case study it was or what kind of study it was, and they say it's a prospective multi-center case series. In the hierarchies of studies, this is one of the best. Later I can make a video on what are the different types of studies and why one study is better than another, but this is one of the best. This is one of the highest ranking. So we're going to skip to the conclusion for a minute, and it says, in contrast to previous short-term reports on adverse effects of ketogenic diet therapy, their 10-year follow-up did not identify cardiovascular risks of dietary treatment for GLUT1 disorder. Now, we can't extrapolate this and say that anyone who follows a ketogenic diet will not have those cardiovascular risks. That's not what this article is saying. But it's saying, in its case, in what it found, if someone had GLUT1 deficiency, it would be unlikely for them to develop cardiovascular risks after following a ketogenic diet for 10 years. So I'm excited to see what this is about, so we're going to pop on into it. You can get the full PDF over here. I already have it pulled up, but I'm excited to go through this with you guys. I think it's going to be really... So now we're going to be going into the actual article. This again is the title, the authors, where they're from. The study was done in Germany. Some key words that we already went over. This was a summary, went over on PubMed. So now we have the introduction, which at first talks about GLUT1 deficiency and how it was diagnosed. I wanted to go into the study design because I think that's important to substantiate the study that we're looking at today. So it goes into all of these different tests that were done to study as well as standardize and assess the patients. So this talks about there were 65 patients at first who were between the ages of 1 month to 18 years old. They were studied at 2 different hospitals in Germany. And something I wanted to mention, throughout this paper, they mention a healthy population, right? And so that was like their standard that they compared these study subjects to. A healthy population doesn't mean like the most fit and active children. It just means children who did not have the GLUT1 deficiency. Okay, so here they keep on talking about that, and then here, this is very interesting. So they tell you what data points they were looking at, right? So they're looking at gender, whether or not they have the gene mutation that causes the GLUT1 deficiency, the predominant clinical phenotype, because if someone has GLUT1 deficiency, they're not all going to present the same way. Onset, age of onset, type, duration, ratio of ketogenic diet, so whether it was which we'll go over the table later, weight, height, blood pressure. Lipid profiles with total cholesterol, triglycerides, LDL, and HDL, and they excluded patients who had not been on the ketogenic diet for more than 10 years, and if they had an interruption of greater than 6 months, and if they had genetic factors that caused hypercholesterol, because then that's not fair, right, to say that someone has high cholesterol when actually it's a genetic factor, it's not their diet. So they're saying that they were approved by the Internal Review Board of Wurzburg University and that they had consent. So now here they're talking about anthropometric measurements. So they look at height, body weight, BMI, As we know, BMI is not always the best indicator, but BMI is an indicator of obesity. So they even go on to acknowledge that due to initial problem and follow-up protocols, no BMI measurements were made after 6 months. But they do look at systolic blood pressure, diastolic blood pressure, heart rate, and many other genuine cardiovascular factors. They do a non-strenuous test, all this stuff. They talk about lab tests that they did. They used enzymes. I'm trying to see where my favorite part of this is. Okay, so the goal of the study was to show whether or not a child who had a GLUT1 deficiency, after 10 years of being on the ketogenic diet, were they more likely to be at risk for cardiovascular disease, because a ketogenic diet is high fat. So what they're using as a marker is that in adults, if they look at the thickness of the carotid intima media, that's in your eye, if that thickness is over a certain number, that means that someone is prone to cardiovascular disease, and if it's less than a certain number, it means they're not. So that's the baseline that they're using, and it's measured the same way it's measured everywhere. They also measure the cardiac cycle the same way they would do for anyone, and they also did an ultrasound on the carotid artery. So those are those three measures, and they talk about some statistics. And so here they talk about the results. They say only 10 of the 65 patients met the criteria, so 55 were excluded because either they disrupted their ketogenic diet for greater than 6 months out of the 10 years, or they weren't on the ketogenic diet for the entire 10 years. They only made 9 years or 8 years, whatever. So we're going to read this table together because I think this is the most interesting part for me. Oh, sorry. Okay, so here are the 10 patients. You can see 5 of them are female, 5 are male. Only 1 did not have the gene mutation, and here they describe the specific mutation, even though 9 of them have that mutation that's different in them. And then here they talk about the phenotype. So this one had a movement disorder, this one had dyslexia and paroxysmal events, another movement disorder. So basically it's either intellectual or movement disorders, except for patient number 7 who had no abnormalities. Age of onset. So this is when they started taking the ketogenic diet. So patient 1 started when they were basically about 4 months old. Patient 2 started at a year old. Patient 3 started at nearly 7 years old. Patient 4 started at nearly 4 years old, and so on and so forth. Now ketogenic diet, they all did classic. The ketogenic ratio is here. And all of these patients are still on a ketogenic diet. And look at their blood pressures. All their blood pressures are extremely normal. Only 1 patient is overweight. The rest of them are normal. And all of them have a low carotid intima thickness, which means they are not likely to develop cardiovascular disease. All right, so going back to our paper. So these charts are basically correlating between the GLUT1 deficiency patients, those 10 children, and then the reference population, their BMI, carotid intima media thickness, and then their blood pressure. And you can see these patients who have the GLUT1 deficiency, they're not so different, and they're no worse. You know what I mean? Like they're not doing worse than the healthy population. If anything, most of them are doing better because there's a substantial part of the reference population that doesn't have the GLUT1 deficiency who is obese and overweight. Similarly here, you see like a lot of patients are just normal. None of the patients, because they're children, which makes sense, none of them had like tremendously thick carotid intima media layers. And so here they have a table of, this table basically explains the figure above, where it's the BMI, total cholesterol, LDL, HDL, and triglycerides, and they do, before they started the study, 6 months, 1 year, 2 years, 5 years, and 10 years, and you can see Some things did go up, but that's natural for those things to go up with age, so I'm not really concerned about that. My bigger concern is here. Well, not even a concern. My bigger interest, I guess, lies lower down. Okay, here, this is the conclusion now. They say the GLUT1 deficiency is a very rare entity, which it makes sense that it is, and the cohort size was small, and so was their external validity, because, again, this is based off of 10 patients. There was absent data. They talk about all of their issues here. So I think this is one of the most fundamentally interesting parts of the study, because they not only talk about some of the vulnerabilities of the study, but also some of the things that were missing. But one great result was that no changes in BMI or blood pressure were observed on long-term ketogenic diet therapy. So that's great to hear. Funding, they had no funding from public, commercial, or non-for-profit sectors. That can be of concern to some people, but I don't think it's that big of an issue. And yeah, now we're into the acknowledgments and the references. So overall, what I would take away from the study is that these doctors followed up 10 years later with 10 patients, and they were able to show that after following the ketogenic diet for therapy for 10 years in patients who have a GLUT1 deficiency, there wasn't any added risk of cardiovascular disease relative to like a normal population. So I hope this was helpful, and I can't wait to talk to you soon. Bye.